All right, so now we're moving on to the second part of the video series in relation to clinical documentation. I wanted to add, that's a part of the last video on the nursing assessment that I did forget to mention. On a nursing assessment, if you have a patient that is agitated, sick, and they are just absolutely refusing to do or answer any questions for you, that is your answer. How they present at the time of admission is what should be in this initial nursing assessment. So if a patient's stating that they don't want to tell you their drug use, they don't want to tell you, what their level of education is, you can literally write on here, refused or unable to assess. So I just want you to know that sometimes when patients don't answer, it's actually a quicker admission because you can actually fill out every section of this assessment based off a patient that is reluctant to answer. The next thing we're going to talk about is going to be the initial nursing treatment plan. Every nurse should be very familiar with these. One thing that happens is a lot of nurses will pre-fill this out before the patient arrives on the unit based off the SBAR. So on the SBAR, it will say patient is coming in for psychosis. This little section, it's kind of small, so it's hard to read and it gets overlooked a lot. But in these areas for long-term goal and reason for hospitalization, they need to be personalized or individualized by a quote. So the reason for hospitalization is not psychosis. It's actually what the patient tells you they believe is their reason for being hospitalized at the time. So what we'll do now is I will have my patient here, Taylor. Taylor, now it's time that we're going to do your initial treatment plan. So I would like to know in your own words, what's your reason for your hospitalization today?
They're watching me.
They're watching me. So you would write down, they're watching me. The next thing is going to be, Taylor, can you please tell me a long-term goal that you could actually complete while you're here hospitalized?
You should know.
You should know. So you would write down, you should know. So no matter what it is or how they present at the beginning of their, admission, you will actually put those in quotation marks. The next thing is going to be right below that is a target date. Make sure that you are aware that a target date is always 3 days out. So if today we're August 1st, the target date would be August 4th. Next, you'll skip over to the next page of the treatment plan. I want you to know that if a patient comes in with any medical conditions, COPD, asthma, back pain, whatever it is, you must make sure that you check it off here and then you go into the computer and print off an individualized care plan for asthma, for COPD, for pain. And that will be included in the initial treatment plan. And lastly, if a patient doesn't want to sign this, and you can tell a patient, you have every right to refuse to sign this, but what this is when you sign this, it's stating that you are an active participant in your treatment while you are hospitalized. So if they refuse, check off refused or unable to sign or whatever the reason might be, and then make sure, just like the nursing assessment, sign, date, and time. Most important time. The RN has to complete this initial nursing treatment plan within 8 hours of their admission. And that's actually located right here at the top. It will say RN has to assess within 8 hours. Lastly, again, with no time, we don't know that it was completed in the time, and that will be something that we're audited for. Just make sure that you are doing all of this when it comes to the initial nursing treatment plans. Thank you.